Hi guys, my name is Marissa and I'm back with Dr. Salazar by popular demand, and we're going to be watching some surgical videos and reacting to them.
Oh, it's clear. Oh, they already treated one eye?
I didn't expect that one. It's so cute.
Yeah, he has two
my
different.
goodness. Oh wow.
They changed his eye color.
Yeah, that looks really good. It almost looks fake. Have you heard of that procedure or seen that before?
I mean, I've seen it in social media. I'm not exactly sure how it's done. I mean,
Yeah.
I'm not an ophthalmologist. I think you have to be very, very careful with anything that's related to your eyes. But if that can be done safely, well, I mean, it's a good option for people that want to change their eye color.
Would you ever do it?
I would. What about you?
I probably would.
That's awesome.
I'm professional bodybuilder.
Those arms, look at those arms. Oh, no.
Muscle, naturalis,
Natural muscles.
sport,
Okay.
live.
I really don't
5
think those
years.
are natural muscles.
Professional.
No.
Looks like he's got like some tissue expander or
Was
like
that
some
like
sort
the
of
implant that we were talking about last time, where
Right.
you could put like muscles in like that?
If those are implants, he has been like pretty much gradually going up and up and up in terms
okay.
of size, because that's huge. That's
Yeah.
very big. And I mean, there's not a lot of skin over here.
Yeah.
So for you to insert such a big implant
Yeah.
in an area that doesn't distend, because it's different from like breast implants where you can put like a bigger implant. Over here, there's not a lot of space.
Right.
So I'm pretty sure that either he did like some sort of tissue expansion or like serial exchange of implants that are getting larger and larger.
Wouldn't that be painful? Almost like, you know, patients that do like mastectomy and then do implants, it's painful for you to switch.
Painful and uncomfortable
Yeah.
and not very practical, especially because the muscles don't match the rest of his
Yeah, I
body, right? I mean, the forearm is completely different and lack
Yeah.
of exercise. I don't know.
What would you recommend instead of doing like that type of implant in that area?
Well, I mean, what you can do is you can do some HD liposuction and delineate the edges of the muscle of the biceps or the biceps, the triceps, the deltoid. And you
Yeah.
can sometimes even consider doing a little bit of fat grafting in that area as well to give more volume or the appearance that you have more muscle.
So HD lipo would be the way to go to get that muscular look, but not over the top.
Exactly, just to edge it a little bit. Areola tattooing after top surgery.
Oh, wow. It looks very natural.
It looks good. When it's performed by a talented artist, and I mean, of course, we don't do the tattoos, but there are many talented artists,
Yeah.
you can achieve a very natural look. I can imagine a situation like that in which you have a patient that, for instance, has lost a lot of weight. And as the patient lost a lot of weight, then you have a lot of hanging skin. And then the patient wants to have a flat chest. So the problem is that the nipple and areola is going to be very, very low, and there's no way to go ahead and lift it up. So you can do something that's called a free nipple graft, in which you harvest the nipple and the areola,
Take them completely
take
off.
it completely off,
Okay.
and then paste it, literally like a cut and a paste. Sometimes when you do a graft, like a cut and a paste, it doesn't look well. Sometimes the tissue does not survive completely. So what you can do is, instead of doing that, you go ahead and you go after what's called breast amputation. So you remove everything, there is a scar, and then you get a 3D tattoo of the nipple and areola. That happens all the time with breast reconstruction after cancer.
That's beautiful work. I mean, it looks great. Oh, how many months post-op would you have to wait to get that tattooing done?
So what you would do is, before you do the tattoo, you normally want to have like a still target. You don't want the target to be moving. So you do the amputation and then you allow everything to heal. And then when there's like no tension, no pulling, no healing,
Yeah.
2-3 months after, you can get that tattoo. So another situation that where you can see it, and I think that's actually what happened there, is that it's a transgender patient. So it's transgender surgery. As you are going from one gender to another, if you have going from female to male, you have large breasts, you have to do what we were talking about, either the graft or you can tattoo it.
There we go. Oh my gosh, those look
I
perfect.
think that's hair transplantation, but I'm not exactly sure what they're doing. Do you know what it is?
So I've seen videos similar to that, and what I've gathered is that a hair extension, like eyebrow extensions, like for your hair
it.
before your eyebrows.
Okay.
And so they're gluing them, and they only last about, I want to say, like 2 weeks or so, and then you have to go back and get like a fill on them
And
again.
redo it and redo it and redo it.
That's
Eyebrows.
something that we offer at the office. Transplant to the eyebrows.
Hair transplantation to the eyebrow. Hair has a completely different growth rate than your eyebrows. You have to do a lot of maintenance because your eyebrows are going to be growing at the rate of the rest of your hair. So so you have to be trimming, you got to be like taking care of it. But it's a very nice alternative.
How permanent would you say that result is?
100%. 100%. Because once you remove a graft, a follicle, that follicle you transplanted, you put it here.
Right.
And that's yours now. And it's going to survive as like the regular way that your hair survives in your scalp.
So if I go back and somebody tweezes that one, it'll grow back.
It'll
again.
grow back because they'll never remove the follicle. They just break the shaft and then comes out. But the follicle's still in there.
Yeah.
So yeah.
So that's a better alternative than doing like eyebrow microblading because it's a kind of one and done thing. It has maintenance, but that's kind of what you're looking for is like a permanent result, right?
Absolutely, totally. I mean, that's a way, another alternative that you have, but it's a permanent alternative. So I think, I mean, it's a good one.
Yeah, that one sounds a lot better.
I still can't believe this happened. This is me 4 days after getting a boob job. I woke up with the most horrible itchy rash all over my neck and my chest. I immediately started freaking out and panicking. Called my doctor, they didn't answer, so while I was waiting for the call, I decided to get my mind off of it and go get some lunch because today was the first day I finally felt good enough to drive, so it felt really good to just get out of the house. Then my doctor finally called me back and said, JC, don't worry, you're not dying. Your skin is just kind of irritated and you're having an allergic reaction to the prep solution they put all over your body during surgery. Nothing too serious, should go away with some time and some cortisone cream. So I went and got some and then lathered myself.
How common is that to get some type of allergic reaction?
I would say it's extremely uncommon. What she had the reaction to is what we use to sterilize the field to make it super clean and to clean her skin. That's what she was reacting to. It's very, very rare. I wouldn't have a specific number, but we rarely see it. We might see it once or twice a year that someone gets an allergic reaction. So it's important to evaluate your patients and for your patient not to feel abandoned.
Patients are able to contact you directly after surgery.
Immediately. I mean, and we have all of our staff is always available to our patients. And then if they have a reaction, we see them, we evaluate them, and then we give them recommendations. And pretty much all those reactions, it takes sometimes about a week to get solved or a couple of days. But normally it resolves. But the most important thing is that patients can reach us.
Yes,
immediately.
Of course.
Oh, I mean that's famous.
Okay, so her implants stopped the bullet from entering her body or impacting it significantly.
The gel inside of the silicone implant slowed the bullet down enough that actually did not reach the lung or the heart, like into the thorax. Let's call it a miracle. That's not the main purpose of having implants, right? But in her case, it helped tremendously.
Do you think it was because like the implants were big and that's what like stopped it?
Well, the bigger, the more it would slow it down.
Yeah. It's like a vest.
Yeah, right. It's like a little bulletproof vest. Oh, Apple Vision. Nice.
Oh, wow.
They're looking at like some sort of CT scan of the brain, and they show you how you can manipulate it and change different angles and look at different slices. One of the things is how can those be used for, what do we do?
Consultations. Can we use those in consultations, like virtual consultations maybe or something?
You can, I guess you can use it for virtual consultations, but it will never ever actually substitute the feeling of things. Why? Because we actually need, if we're operating on a body part, we really need to see the skin elasticity, we need to see how firm is the tissue, and you cannot substitute that. Even though we do virtual consultations, but we never operate on anyone until we actually do a physical examination.
Right. Oh, wow.
Oh. 4.
Wow. That just took off like 30 years.
After surgery or after a filter? I mean, right?
So do you think that was real or do you think that was filtered?
I think it's so extreme.
Yeah.
Right? I mean, that makes me believe that it is a filter, because even if you look at the skin texture normally, and you know that we can change the skin texture, but that's an immediate after surgery result. The skin doesn't look perfect right away, right? That takes some time for the skin to recover. So I don't know, maybe it has a little bit of both, maybe a little bit of surgery, maybe a little bit of filter.
Because that was like butter smooth afterwards.
Right?
Yeah.
And it was an immediate result. So, oh, look at that result.
Oh, wow. That completely changed her face shape.
Totally.
Oh,
Is that a filter, or is that
makeup? Is it?
And why does it look? I mean, it looks too cartoonish.
Yeah.
But that looks more of a natural result. And also, I would say that those results are in reality not very natural.
It almost looked like he slimmed her jaw too, which would have been like a way more intense surgery.
Exactly.
Not so much
like
cosmetic, right?
Orthognathic surgery. I would say sometimes trying to obtain those results, they are trendy. People sometimes start to look like a filter, and that's a trend. I mean, that's happening.
Is that something that you would ever do on a patient if they requested it?
No, I wouldn't.
I feel like you have very natural results, and that's why your patients like you so much.
Oh, yeah, reduced the lip, is that?
Oh.
They were doing, they shape it by removing some tissue, part of what we call the wet vermilion, what you actually don't see. You wedge like a part of it, and then that will give you a different shape. In her case, like a more
heart shape type of thing. Is that something that you would do in the office?
Have I performed something similar? Yes, for everted lips.
Oh, okay.
For too much of an everted lip, but not to reshape the lip. The only thing is that I would tell a patient that is considering having a surgery like that it's kind of permanent.
You can't
go
back.
What
if you do filler or like a fat transfer?
Well, if you do filler, but now you are trying to fighting back for something that you actually already paid for. So once that's permanent.
That makes sense,
And filler, you're going to have to be filling up, and it's never going to be the same as your natural lip.
Our favorite food still. How are you, my loves? I am completely out of it.
So the twins getting surgery.
Oh, it looks like they did a rhinoplasty.
Recently.
It takes us as needed.
Are they speaking English?
They're talking about narcotics.
I took a look at my boobs. I freaking love them. Like this, yeah.
They can't wait.
They're two completely separate girls, but I suspect they share one brain.
Oh, wow. Strong statement.
I'll drink more after this.
You been drinking?
No,
What have you been drinking?
I have one.
Drinking.
Water? Like the set?
Yeah.
Oh my goodness.
Doesn't make any sense.
Percocets and wine, because they're both depressants, and you can not wake up.
You guys are gonna be anxiety attack because
Are you drinking alcohol also?
Oh my goodness.
Of course. What do you mean, of course?
We're not going to do that.
Okay, so the dryness.
You're worried about dryness, we're worried about you dying. Mixing alcohol with narcotics.
It's one of the worst things that you can do.
Unconscious, stop your breathing, and basically you're found
Dead. Exactly.
No, that's not what he asked.
I just can't believe it.
Look at us, look at me right now, and say you're not going to drink it.
I promise. Cross my heart.
Looks like Dad's yelling at them.
Exactly.
Do not do this.
She does know.
And don't appreciate Christina. Tell me, okay, she got it, stop it. No, if you have a problem, we have a problem.
No.
So we don't want to.
Exactly.
Oh my goodness.
You got to work as a team.
How long before do you have to stop drinking and how long after do you have to stop drinking?
But in an ideal world, you're talking about, 2 to 3 days before not to have any alcohol in your system. I think it's ideal. And then after surgery, I would say you're going to have anesthesia that your liver, your body is cleaning. So definitely to add another ingredient that your body needs to clean, it's not a good idea, right? So as long as you're taking narcotics, as long as you are directly recovering for surgery, it's not a good idea to mix alcohol with other medications and other things. No alcohol after surgery.
How long after surgery are patients taking their medications for?
It depends on the procedure, but you're going to say, like, in terms of narcotics, probably you expect them to be taking them the first 2 to 3 days or even up to a week. But the way we do it is we try to minimize the amount of narcotics that our patients take. So we use several tricks. We use local anesthesia. We use prolonged release local anesthesia. We also use muscle relaxants, anti-inflammatory medications. So we try to do everything we can so we can avoid the narcotics. Some patients show up saying, I didn't take my narcotics. What do I do with this? What we're trying to do is to minimize the use of narcotics, but at the same time, if they feel like they need it,
it's available.
They have it, it's available, but never with alcohol.
So I'm already perfect, but I want to look a little more perfecter. Excellent. Do you have a picture of a look you'd like to achieve? Oh yes, cartoon Jasmine. Very popular. You think giving me her look? Absolutely. Is it natural? Very natural. So like
extremely natural.
We inject some natural Botox. We take out your natural chin and replace it with
very
natural
organic,
plastic.
Very natural.
Nice. And we shave down your natural teeth and put on some natural veneers. Wow, also natural.
That is too funny. Have you ever had anybody ask you or like request to look like a cartoon?
Like no, because that's a way that you have to communicate with patients sometimes, because it's important. They come in having a clear idea of how they want to look or what they want to achieve, and they show you some pictures of
Kim
real
Kardashian,
people.
Khloe Kardashian,
yeah, exactly, but not a cartoon. I mean, it's like I haven't never seen anybody like showing me a SpongeBob. Saying I want to look like this.
Nobody wants to look like SpongeBob.
Too square.
So obviously plastic surgery isn't natural, but we're not here to give like a super augmented look, right?
Exactly. I would say like everybody has different goals, but in reality, when someone comes in and says, I want to have a natural look. Of course, the most natural thing that you can do is no surgery. But what we are going to do is we're going to be conservative with our treatment, and we're also going to be enhancing their beauty. Just give them that little boost. Versus someone that comes in that says, well, you know what, I want to have more of an augmented look, more of a something that is a little more provocative, then you can steer the wheel towards that side of things.
Okay, so we can do both a little bit.
So we can do both, but always within the real world.
Yes.
No, Jasmine.
All right, guys, so that is it for today's videos. No more reactions, but we do want to see more videos and continue this series. So if you can send us some DMs to either our LJC or our Dr. Salazar account, we'll react to some videos that you guys send us.